Yvonne Emmanuel is a recent patient of the Victoria Respiratory Hospital who, in an exclusive News Force interview Tuesday, provides a rare glimpse of life of a patient on the wards at the recently refurbished facility. Miss Emmanuel was admitted to the Respiratory Hospital after spending a night at Casualty, an experience she recounts favorably. But she was then transferred from Casualty to the main wards.
They took me up to the respiratory. There are 4 rooms in there. Everybody has their own toilet and bath. It's a nice space. But there's no ventilation in there. When you get in there, you get your room, but the doors are shut. And this was my issue.
Miss Emmanuel said the policy of locking up patients in a windowless room was torture. She said she had no access to direct sunlight or fresh air, 2 of the elements she thought would help in the recovery of COVID-19 patients and those suffering with other respiratory ailments, such as herself.
If you go to a respiratory clinic, you should have access to sunlight. You should have access to fresh air. Even if you go to the respiratory clinic and we're in the air of COVID, they still come to do your vitals and stuff. So if they're going to wear masks to come do our vitals, we could wear masks to go get some sunshine. What is done there? They keep you in the room 24/7.
The recent Victoria Hospital patient said she would do anything not to return to the facility. She says all she wants is for sensible change to be introduced to the management of the respiratory hospital.
My issue is to appeal to the authorities to please investigate. Please do something, because people cannot be sick and be in a room closed. It cannot be. That's like a prison. It's not fair. It's not fair, because I had it very hard. And right now, if I have to go there, I'd rather stay at my house. And if I have to die, I will die there. I cannot go back to that respiratory hospital. I cannot. Under these conditions, I can't. Because sunlight is important. And fresh air is important. We can get fresh air by putting a mask, and you just give people turns.
Miss Emmanuel said the hospital staff was professional and courteous. The facility was well kept, but the denial of fresh air and sunlight with the locking up of patients experienced during her 1-week stay at the medical facility made life unnecessarily unbearable. Stanley Lucien for the HTS News Force.